Hey everybody, I'm Peter Felice. I'm a board certified plastic surgeon in Greenville, South Carolina, and this little video is to give you some information about a general rule of thumb for mommy makeover recovery. So mommy makeover means a lot of different things to a lot of different surgeons and a lot of different patients. For my practice and my patient population, mommy makeover combination surgery is basically anything with a breast and an abdomen and something else involved, just to help with overall aging, rejuvenation, and trying to get moms to feel and look the way they want to feel and look after pregnancy. So in general, for a mommy makeover recovery, there's a few things I tell my patients, and the number one thing is no heavy exertional activity for about a month after surgery. Patients can be up walking around the same day as their operations, but I don't want any aggressive cardiovascular activity or running or hiking or yoga for about a month after the operation. It's perfectly fine to do some upper body lifting up to 10 pounds or even 15 pounds depending on the patient and the operation within the first 2 weeks of surgery. But generally expect to be down and not quite back to your normal activity for about a month after the operation. The type of medication your doctor prescribes to you is going to depend on what he or she likes for his patient population. I stay away from narcotics as much as possible and do an enhanced recovery pathway after surgery. So I'm doing lots of non-steroidal anti-inflammatories and some medications to help just soothe the nerve sensations after the operation. Generally try to stay away from narcotic medication as much as we can. These medications are helpful usually for about the first week or so after the operation. Depending on what I'm doing for my patients, some are off all medicines by 7 days after the operation. Depending on what type of operation we do for your abdomen, I tell patients to expect to have some drains in place. Now, how long they're in place depends on the patient. Rule of thumb is to expect a drain for about 7 to 14 days. Might be a little bit less, might be a little bit more. I promise I won't leave it in longer than it needs to be, but I'm also not going to take it out before you're ready to have it out. Depending on the type of abdominal procedure we're doing as part of the mommy makeover, it might be a drainless procedure that doesn't require you to have drains, but make sure you're talking to your plastic surgeon about what he or she plans to do for the recovery period and whether or not you can expect to have drains as part of that process. I think that lymphatic massage is a fantastic adjunct to abdominal procedures. It can be an abdominoplasty, mini tummy tuck, liposuction procedure, and all of my patients have appointments with a certified lymphatic massage therapist to make sure that they're feeling better and looking better faster after their mommy makeover procedure. I generally tell my patients not to submerge underwater for about 3 to 4 weeks after an operation. So this includes bathtub, hot tub, lakes, pools, oceans. And the idea is I don't want to risk any bacteria from the water potentially causing a contaminant or an infection at the operation site. Most patients can expect to be back to normal activity both at work, in the gym, within a few weeks after the surgery, depending on what it is. Usually by about a month after an operation, I tell patients they're okay to do whatever it is that they want to do, but just let their body tell them if they're pushing it too much and need to scale back. Depending on the activity, patients are going to be up and normal as soon as 1 day after the operation, but I generally tell patients to expect to need about 3 to 4 weeks before they're back to full cardiovascular physical activity in the gym. Depending on the type of operation you have for the breast and body, I tell patients not to expect to see the full results sometimes upwards of 6 months to a year after the operation. It can take that long for the body to get rid of all its swelling, to get to its final shape and size, and if we're doing a breast procedure, for the implants or the breast tissue to settle in its final position. Now, when you wake up from your operation, you're going to see and feel a difference immediately depending on the procedure that's been done, but you got to give yourself time for the swelling to go down and for your body to start to adjust from the surgery itself. Usually by about a month to 3 months after the operation, you're going to be well on your way to seeing your final results. But again, everybody's body is going to be a little bit different. It's not unusual to have to go about 3 months to 6 months to sometimes 12 months before you see the final results from your operation. In addition to massage therapy being an important adjunct to the recovery after a mommy makeover abdominal procedure, I tell my patients that I want them to be in an abdominal compression garment for about 6 weeks minimum after the operation. The reason why I like compression garments is this helps to reinforce the size and the shape and the contour that we've achieved in the operating room with an abdominal procedure. And it almost helps to kind of squeeze and wring out a lot of that extra fluid to make sure that it's not staying below the surface of the skin where it can cause irregular contours or firm, hard scar tissue. So I think that the compression garment, in addition to lymphatic massage after an abdominal operation, is a necessity after an abdominal contouring procedure as part of the mommy makeover. There are risks and complications that can occur after any elective operation. Commonly, we'll see a fluid collection after procedures. This could be a protein fluid collection called a seroma, or it could be a blood fluid collection called a hematoma. A lot of times, these are small complications that can be managed by your doctor or nursing staff in the office after the operation, or with lymphatic massage therapy, or with assistant compressive garments. So thanks for watching this video, just talking a little bit about mommy makeover recoveries in general. Make sure you're having a very, very in-depth conversation with your board certified plastic surgeon to know exactly what he or she plans for your recovery and what you're going to expect after your operation, so you look and you feel fantastic afterwards. Any questions and comments are always welcome, and be sure to like this video and subscribe to see more great content like this. Thanks so much.